Hi, this is Dr. Pelto. I want to go a little bit over foot and ankle wounds, specifically why did I get my foot wound, the 4 reasons wounds don't heal, which includes the wound healing triangle, and what I can do to heal it fast and what you can do next. So let's go looking into this here. So first of all, why did I get a foot wound? A foot wound is usually caused by some type of high pressure area. You can see some of the wounds here. This was caused by a callus. Once again, caused by a callus and caused by a callus. Usually it's a high pressure area, and maybe there may be a bone underneath it that's more prominent. You get a little cut underneath the blister, and then it can get infected into the bone, creating a kind of a bone infection. It's kind of a problem there. People with no foot problems usually don't get foot wounds. Usually it happens with people with diabetes and maybe neuropathy or poor blood flow. Let's exactly look at this wound healing triangle here. So if we look, the wound healing triangle really explains what causes foot wounds. So usually it's high pressure, whether it be a callus or a bony prominence, some type of a deeper infection, poor blood flow, and then poor blood sugar. All of these kind of combined can cause a foot wound and also make a foot wound hard to heal. So the same things that cause it are the same things that make it really, really hard to heal. So let's look at each one of these, really the 4 main causes here. So first of all, let's look at blood sugar. If your blood sugar and nutrition aren't doing right, you're going to have a hard time. That's really the mainstay of this. You have to have your blood sugar under control, hemoglobin C, A1C under 7, trying to eat enough protein. There's a kind of this low-fat, high-fat, low-carb diet, which works well for this. Make sure you talk to your doctor about it. But really, the higher the blood sugar, the slower it's going to be to heal things. So that's the first aspect of healing a foot wound, making sure your blood sugar and nutrition is under control. If that's okay, then the next thing you have to look at is really if there's any high pressure areas. Are there any high pressure areas like calluses underneath the area? Or do you have a tight heel cord that can actually, when your heel cord's tight, you're not moving at the ankle joint, you actually put more pressure to the front of the foot. So do you have this? Are there any other areas of high pressure? Is one of your bones maybe more prominent than the bottom, or the toe has a curve in it? That may be causing it to rub on the shoe. Those are all causes of high pressure. So that's the second area that we have to look at. Next, we want to look at as well, also with high pressure, how can we take the pressure off? Do you need to be in a wheelchair? Do you have to use a walker? Really, anything that you're walking on is going to cause pressure. So even a boot like this, or a boot like this with these removable pegs, or something like this that supposedly isn't supposed to put pressure to the front of the foot, it still does, because you're pushing off of it sometimes. The best thing is either a wheelchair, and if you have a condition called Charcot foot, a Charcot boot. This is a boot that you put your foot in, and it really takes the pressure off by putting more of the pressure into the leg area. Let's look now at how blood flow and swelling can hinder healing. So if you have poor blood flow, meaning if you have a lot of swelling, if you have sores in your legs, cuts in your legs, that can be hard to heal the wound. So you have to really look at a lot of swelling can cause this. Specifically, you want to look at if both feet are the same color. If one is discolored, it may be due to blood flow and clogging of the arteries. That can really affect it. Poor blood flow really is one of the biggest culprits from healing and causing them. If you don't have good blood supply and you get a sore, it's going to be a lot harder to get all that blood down there to heal it because you don't have the blood. But as well, if you need to take an antibiotic, you may not be able to get that antibiotic down there. Some things that we can do to evaluate that, we can actually do some vascular studies, which are blood flow studies, with a device that you put blood pressure cuffs on the legs and compare it to the arm, and that can tell you how the blood flow is. Also, we can get a vascular consult from a vascular surgeon, and sometimes a Uniboot or some type of thing to get down the swelling. This is a compressive dressing around the leg and foot to get down the swelling, because sometimes the wound won't heal because of the swelling that's there. Getting the swelling down can help. Let's look at this next aspect, which is a deeper infection. Are there any areas of high pressure under this area? So for example, in that wound we see, is there any infection in there? How can we tell? We may need to get an MRI. As you can see the picture of the MRI that shows some bone infection here in this bone. Are there any other infection or draining from the wound? Calluses can have a high pressure area that can cause a wound, and then once the wound gets infected, it gets infected in the skin, and then if it goes down to the bone, then we have to remove that bone or do 6 to 8 weeks of IV antibiotics. So with a wound, what can you really do next if you have a wound? You have to determine what type of dressings you need determine if you need nursing or physical therapy at home to help you kind of stay off the foot, and then really determine how you are going to stay off the foot. There's a couple of other resources that I'd like to have, so if you look at this presentation on my website, drpelto.com, you can get to it under patient presentations and wounds. There's a wound tracking sheet. You can click this link and it'll go to something where you can actually look at how your wound is healing. I'll show you right here. This is an example of this wound healing progress guide, so you can kind of look at how that's healing. And another thing I have here is kind of what's next. This is an informational thing that you can fill out on your own. Hope you found this helpful. If you want more information about foot wounds, you can go to healmyfootwoundfast.com. That's one resource, as well as drpelto.com, and put your email in either one of those, and it'll send you a list of resources for you.